Good evening, everyone. Welcome to the February 9, 2023 meeting of the Community Board 6 Health and Human Services Committee. My name is LV Barroso, and I'm the chair of the committee. This meeting is called to order at 6:35 p.m. Tonight, we are joined by Assistant District Manager Brendan Burt. As a reminder, New York State law now requires all community board members to have their cameras on and their first and last names displayed from the time the meeting is called to order until the time the meeting is adjourned. If your camera and your members of the public, you can raise any question in a feature of Zoom. If there is time following the committee's discussion, we will field questions from the public. Single man tonight.
I'm sorry to interrupt, Elvie. You're breaking up a little bit. I don't know if others are experiencing the same issue.
Okay. So you all should have received an email from the board office with a link to a doodle sign-up sheet for minutes takers at your committee meetings in 2023. For your convenience, the link to the sign-up sheet is being posted in the chart right now. We will now take attendance by roll call. Brendan will conduct the roll call.
Committee members, I will call your name and you will unmute yourselves. When your name is called, please say present. I will announce if there is quorum. Marty Barrett.
Then you can write something.
Present.
Elvie Barroso.
Present.
Jason Fromowitz. I do not see Jason here, so he is counted as absent. Sadie Howard.
Present.
Sandra Leftoff.
Here.
Raj will not be present tonight. Kevin O'Keefe. I also do not see Kevin, so he is counted as absent. Aisha Siddiqui.
Present.
Hannah Singleman.
Present.
And Ronnie White. I do not see Ronnie here, so she is counted as absent. However, we do have quorum.
Good. The agenda for tonight's meeting was distributed ahead of time by the board office and is reflected on the screen before you. If there is no objection, we will adopt the agenda. Members of the committee, if you object to adopting the agenda, you may raise your hand through Zoom. See objections, the agenda for tonight's meeting is adopted. The minutes from the January 12 meeting were distributed ahead of time by the board office. If there is no objection, we will adopt the minutes as drafted. Members of the committee, if you object to adopting the minutes, you may raise your hand through Zoom. Seeing no objections, the minutes from the January 12 meeting are adopted. They will soon be available on the Community Board 6 website. In order to conduct an efficient meeting, let's observe a few ground rules. No one may speak until granted the floor. Committee members, if you have a question about committee business or wish to make a motion, please raise your hand through Zoom. The chat function should not be used for committee business questions about agenda topics. All such remarks should be made on the record by raising your hand through Zoom. Chat should only be used to alert us to any technical difficulties you are having or to state in writing information that was already stated aloud on the record during the meeting. When a committee member is given the floor to speak, I will identify you and you can unmute yourself so that you can speak. Committee members are required by the state open meetings law to have their Zoom cameras on and your first and last name displayed during tonight's entire meeting, from call to order to adjournment. If you must step away from your computer briefly, you are required to leave your cameras on. So tonight's agenda, we have two topics. The first one is a presentation on the spatial equity tool that's designed by Transportation Alternatives and MIT. Our speaker for tonight is Philip Majkowski. Philip is the Director of Research at Transportation Alternatives, where he is passionate about bringing a research and data-driven approach to reclaiming streets for better walking, biking, and transit. Prior to his time at the Transportation Alternatives, Philip brings over a decade of experience in organizing politics and policy in both Washington, D.C. and New York City. Philip holds a master's in urban planning from NYU Wagner School of Public Service. So please welcome Philip.
Hey everyone, thank you so much for having me. Just making sure I had some audio issues earlier. Can everyone hear me?
Yes.
Yep.
Great. Okay, terrific. Great. So yeah, thank you so much for that intro. Philip Majkowski here, Director of Research at Transportation Alternatives. We're a nonprofit advocacy group located right here in New York City. So today I'm really excited to show Spatial Equity NYC. This is a new tool that we launched a few months ago now, in partnership with MIT. So yeah, let me just get rid of my, okay, so we think that this is really a first of its kind tool in New York City, and that Transportation Alternatives, we also call ourselves TA, so if I use that short, that's what it stands for. We think that TA really is in a unique position and at the intersection of so many different issues to bring data transparency on anything that's related to streets. So, you know, issues as far-flung as asthma, surface level temperatures, bus lanes, traffic fatalities, noise pollution, etc. So in this demo, this is actually going to be a live demo, so I don't have any slides or anything like that. It'll be very dynamic, and I'll show you how to use the website. So I strongly encourage you to maximize your screen as much as possible so that you can see all the details on how to use the website. I'm even going to turn off my video to minimize distraction as much as possible on your screen so that you can focus on the screen. And so this is the website. When you visit, and I'll include all the links, a link to our report, my email address, etc. at the end of this presentation. So when you visit Spatial Equity NYC, this is the landing page here. There's a really beautiful 90-second video that introduces you to the website and into the concept of spatial equity and spatial equity. And here on the left is kind of like your control panel. So you can view all of the data either on a citywide scale or by community profiles. So I'll show you how to explore spatial equity in both views, but we'll take a look at the data through a citywide lens first. So I clicked on citywide, and we have 15 different indicators, as we call them, or data layers, and all of them are divided into these three main buckets. There's a mobility bucket, environment, and health. So if you were to click on any of these, you would get more options to view different types of data. So right now we're in the health section, there's asthma, noise pollution, fatalities, traffic injuries, and air pollution. So if we were to click on noise pollution, for example, you are now, remember, reviewing all this data from a citywide scale right now. So underneath this noise pollution drop-down menu, you'll always be presented with more information about the topic that you chose and why it's so important. And it's chock full of cited research. So if if there's a statistic that you want to use here, or if you find it really shocking and you just want to make sure that, that it comes from a reliable source, you can always click through and see, the research behind it, the story, etc. And here in the center panel is this histogram. So the main concept of Spatial Equity NYC is to show you all these 15 different data layers and how different districts rank across the city amongst themselves. So you can view the data on, I'm pointing now here on the left side, if you can see my mouse, you can view all of the data either through a city council lens or through a community board lens. And just easily by clicking one of these two buttons. You'll see that histogram change. Right now we're viewing city council view, but of course I'm going to switch this over to community board view here, since this is a community board meeting. And these bars here represent levels of noise pollution. So the longer the bar, the more of that issue, whatever you selected, there is. So since we chose noise pollution, you might hear the sirens in the background. I too live in Manhattan, so there's going to be a lot of that. I apologize. Here in the histogram, the bar with the longest line is Bronx Community Board 9, and the quietest community board is here at the very bottom, which is Bronx Community Board 11. So this is a really great view to see the inequities and see just how drastic and how steep this curve is between the quietest district and the loudest district, or the community board with the fewest trees or the most trees. In the middle of the histogram, there will always be this dotted line, which shows the citywide average. So you'll be able to see if your district falls below or above that. And you'll notice that the community board numbers change as you go from bar to bar. If you want to compare two different districts, so this is Manhattan Community Board 12, and you want to compare it to Manhattan Community Board 1, you have this ability to staple the districts. If you happen to forget which part of the borough Manhattan Community Board 12 represents, or if you're in the city council view and you forget who the council member is for that district, you can always click on this number here and it'll bring you to that district profile. It'll show you where on the map it is, what neighborhoods it covers, and if it's in the city council view, who represents it. What might be really helpful for this group here, especially on the bottom here, I'll just clear these pins so that we have a cleaner view. And on the bottom here, there's this option to view the data by borough. So now we get to view this data and see Manhattan is represented with the red bars. So you see that almost all of them, all the red bars are above the citywide average here. And then on the right side, you'll always be presented with 3 solutions to whatever problem that you selected. So since we're still on noise pollution, there are 3 scalable solutions to make your block, your neighborhood, or your community board less noisy. So 2 is chock full of research and stories and reports from trusted sources, so that you can feel confident to use that data point or to use that idea. One important aspect here is in any time you're viewing the data, there's always going to be this information icon here. So when you click that information icon, it'll give you more information about the source of the data, when it was last updated, when it was last uploaded to the site, and there'll be an option to click to learn more. This was maybe the most important aspect of the website. We did not press the scales behind the scenes by any means. Almost all of the data is available or taken from New York City's open data portal or from the US Census. And we're extremely transparent. Every single indicator has that information icon. You can click to learn more about the data, and you can download the data set yourself if you want to do your own analysis or send it to a professor or whatever to double check. But having confidence in the data is the most important thing. And having the data so much, almost all of it come from New York City's open data, you have the ability to say, based on the city's own data, my community board ranks second loudest or third loudest or has the second fewest trees, whatever indicator you're talking about. Right now we're viewing it through that histogram view. There's list view as well, which is really easy to copy and paste. But I'm actually a really visual person and I love maps. So there's also this map version here. I know that we're doing a lot of different things. So if you are distracted with like a work email or Slack or something else, this is like the part that I find the most beautiful and the most captivating and maybe the most useful for y'all. So I strongly encourage you to take a look here. So this is the darker the color, the more there is of whatever indicator you chose. We're still on noise pollution. So the darker purple means those are the loudest parts of the city. And as you zoom in, you're going to get more and more detail. So although it's great to know, that Manhattan Community Board 6 ranks, it's actually the 4th loudest community board out of 59. But when you zoom in, you'll actually get more detail. And you see that noise is not evenly distributed across the community board. Gramercy being significantly quieter than the other parts of the city, other parts of the community board. This is a really great feature because, if we were to switch this to the tree canopy, for example, you see, zooming out here, you might see, all right, well, it's that orange color. It's not as bad as community board 5 next door. Maybe we're doing fine on trees. We don't need any more trees in the community board. But when you zoom in, you really see that southern part of community board 6 is really pulling the rest of the community board. This is almost all of where the trees are located is down here, and the lighter color, which means that there's fewer of that indicator. We're looking at tree canopy now, but there's significantly fewer trees in the middle and the northern part of this district here. One other aspect I want to show too is the ability to layer on US Census data. So down on the bottom here, you'll see that there's a tab called Show US Census Data. All of the data that comes from this tab comes from the US Census, from the 2020 census. If I were to click here, and then we're presented with all of these different data layers. So there's race and ethnicity, poverty level, vehicle ownership, and also how folks commute to work, whether they drive alone or they walk, bike, or ride transit. So if I want to, for instance, see how my neighbors get to work, I were to click on this, and I want to look at where the cyclists are, for example. There's this collapse panel arrow here that a lot of folks miss, so I'm going to click that right now just to get a more full picture, more full map of this. And you see, so now I have community board 6 highlighted. On the bottom, we're still looking at tree canopy on the left, where the lot more trees here, as I mentioned, in the southern portion of the district. And then when I'm looking at commuters who bike, there happen to be 2 unrelated ones, just because I just took those out. But you see, okay, that there's this darker purple means that there's more cyclists who commute. So there's more cyclists down here in the southern part of the community board than the northern part of the community board. If I were to bring that panel back and choose vehicle ownership, for example, you can also view the data, see from that point of view. Maybe not the best choice here because it's actually pretty uniform. Almost all of Manhattan, south of Central Park, has extremely low vehicle ownership. But now we know Community Board District 6 ranks 31st out of 59 community boards for trees, and that 77.1% of households in the community board don't own a car. So you have that ability to both look at whatever data layer you chose, whether it's tree canopy, bike lanes, traffic fatalities, etc., along with US Census data. I'll pause there. One last thing, I'll just say one last thing too, is that you'll see that there's the share button down here. Yes, there are the typical media share buttons, Facebook, Twitter, LinkedIn, if you want to share what you're viewing. But if you were to click this icon, or if you were just to, at the very top here, take this URL, one important aspect of this website was we wanted to ensure that whatever you're viewing on your screen right now, if you want to copy that URL and send it in an email or send it over Slack or tweet it out or whatever, you have full confidence that when anyone else opens that exact link, that whatever you are viewing on your screen, right now we're looking at tree canopy and vehicle ownership. If I were to send that to anyone else, when they were to click on that link, they're going to view exactly what you saw on your screen. So you don't have to explain, when you send the link, like, okay, then you have to find tree canopy and then you have to find vehicle ownership. You just, if you find something shocking here, or something surprising, you can just copy that URL and send it in a chat or a tweet or wherever you'd like. I'll pause there just to see if there are any questions. I'll leave the screen here. So right now we're looking at traffic fatalities. That darker purple means that there are more traffic fatalities, and the very, very light pink means that there's significantly fewer. And I'll just leave it here, highlighting Community Board 6. And you'll see that the center part of the community board has significantly higher traffic fatalities. But I'll stop talking now, turn on my video, and see what questions there are.
This is terrific. It really is a great tool. How long did it take you to master it?
Nobody believes me when I say this. We built this tool in 3.5 months with MIT. It was lightning speed. This was my baby. This was my entire life. This is the only thing I would talk to my friends about during those 3 months. But we really wanted to get it out as quickly as possible. Which reminds me, this is a product that is going to be evergreen. It's not going to sit on a shelf and collect dust. We are already moving forward with versions 2.0 and 3.0. And because we had to build out that first version extremely quickly, we're really going to rely on folks like you for versions 2.0 and 3.0 to hear what do folks on community boards, advocates, the public, electeds, what do they want to get out of this website? What data layers do you want to see next? What US Census data layers you want to see next? What would be most helpful for your job? Because, having a tool like this and be able to make a case for more funding for your community board because you rank dead last in trees or, with the highest asthma rates or whatever it is, could be extremely powerful. So we want to make sure that it's useful especially for community boards, because you play such an important important role in New York City.
I have a question, but I'm not, on one of these things, it looked like the rate for asthma in Stuytown, Peter Cooper Stuytown was high, right? Unless I got it wrong, which was surprising, right? It's an area with trees, blah, et cetera. So was I wrong in that?
No, yeah, so, yeah, right now we're viewing asthma. I just pulled that up, and the southern portion of the community board does have higher asthma rates.
Yeah.
You know,
I mean, I get it for, because you were talking, excuse me.
yeah, it's
Con
likely
Ed plant
because,
is right below you.
What?
The Con Ed plant is right there.
Oh, is that would be the explanation of, well, I don't know, but if you look at the East Village, it's not that, right? And Con Ed is on 14th, but you got the East Village.
No,
on-
the East Village is the same color. It's yeah.
Oh, it is?
Yeah. A lot of it actually has to do with the FDR. So, you know, the second largest contributor of greenhouse gases in New York City and in New York State is emissions from passenger vehicles. And it's not even from buses and from trucks. Those are small percent. So being so close to the FDR here is probably the significant contributing factor to why it's so high here.
Okay, but that doesn't hold up for Murray Hill, right?
Yeah,
So why
that's
would
true.
that be? That there
Yeah.
is, I'm just trying to figure out the logic and so on, what it's telling us. So
Look
if
at
I-
Astoria and see the plant there.
What?
Yeah, asthma is a little tricky. You know,
Okay.
let's look at see what it looks like for air pollution. Air pollution. I mean, terrible for the entire borough, so it's the same uniform color. But although air pollution plays a major role for asthma rates, there are many contributing factors to asthma other than just air pollution. It's I could probably go for like another half hour about why that is, but it has to do with like housing stock and housing quality, everything to whether cockroaches are present, to healthcare, how severe the asthma is, etc. So if you don't have access to healthcare, you might never know that you have asthma, and you might never report that on a survey. So yeah, asthma's pretty tricky.
So would that mean that in an area which has a seemingly lower rate, that could be about the fact that people are not reporting it or getting it diagnosed?
It's
Just so, again, so I understand what the data
Yeah.
is representing.
yeah, so it's the data comes from the Department of Health. So New York City does a really exceptional job. You know, unlike a lot of states across this country, the Department of Health really goes above and beyond checking for asthma rates. It's a small contributing factor, but it could just be that small difference is why it's a slightly darker shade than Murray Hill. But yeah, asthma is tricky. You know, some folks think it's better to look at asthma hospitalizations, because if you're hospitalized, you know, there's no escaping that. That's going to be marked on your record and with the city. Some folks don't think that's as best of a mark.
Excuse me, can somebody mute your? Thank you. Okay.
So right now we're viewing, I'll zoom out just so we can get a citywide view, but this is air pollution on a citywide scale here.
Thank you so much, Philip, for speaking to us about this awesome tool. I think I just have one. Is the latest data that you have under community?
LV, you broke up a little bit.
Philip, my question is, what is the latest data you have? Is it for 20?
I think the question was how recent the data is and whether it's from 2022. LV, maybe you can take the question in the chat if that wasn't it, but I'll answer that question regardless. But so because the data relies on, so the US Census data comes from the 2020 US Census. That'll be updated annually because the US Census they do the big census every 10 years, but they do smaller updates every single year. So we'll update that shortly with more recent data. But because the website so relies on open data, we are unfortunately at the mercy of New York City and how frequently they update the data sets. So traffic fatalities and traffic injuries, they update on a daily basis. But for instance, the percentage of streets with protected bike lanes or the percentage of streets with bus lanes, that's a data set that only gets updated once a year. So those two data sets, for instance, get updated in May. So once we hit in May and the city updates it, we'll update it here as well. But if you were to click on the information icon for any of the data layers that I pointed out earlier, you'll be able to see where the data set comes from. And I know all the ins and outs and have all the alerts for when they are updated. So once they are updated, we'll update it on the site as well.
I don't see any other questions. It also looks like we lost LV. So hopefully she'll be able to come back. I see Gabe Terzo, who's actually the vice chair of our transportation committee and was until not too long ago a member of this committee, has his hand raised. Gabe, you should be able to speak.
Okay, thank you. Philip, I just wanted to thank you for answering my email and coming on and doing this presentation. This data is fantastic, and we will absolutely be using it in the transportation committee. And again, I don't really have a question per se right now. I just wanted to say I'm absolutely fascinated with this, and I can't believe someone built it. And thank you again.
Yeah, of course. Yeah, we're really, this is like the democratizing of data, and we're so lucky to live in a city like New York that has so many different open data sets. Unfortunately, when anyone tries to download it, it's just millions and millions of rows of data. And, community boards or elected staff, they don't have the time and resources to put those rows of data into a map or a ranking system or whatnot. So yeah, just really lucky to live in a city like that. I wish the data updated a little more frequently as a researcher, but yeah, I'm just happy to bring this to life, and it really makes me happy to hear that it'll be used.
Thank you.
And
Thank you so much, Philip.
Great. Just one last thing. I'll just post here, unless there are any other questions, but I'll post my email address. So if you have ideas of what else you'd like to see here, or if you have a question that pops up later tonight or tomorrow and you want to get some clarity on, because I really do want to make sure that this is used by community boards and that you feel confident walking into any meeting to use it. So anytime, feel free to email me. There's also a link that I'm including to our report card if you really want to dive into the details about what we found. And then a link to the website, which is just Spatial Equity NYC, but I'll include that in here as well. But yeah, thank you so much for the invite. Would be really, would love to come for a future meeting or for any other committee meeting in the future. And thank you for what y'all do. So I appreciate it.
Thank you. Okay, so our second Agenda topic for tonight is a presentation from the NYU Langone on a medical study on lung donation. So let me introduce the speaker. Our speaker tonight is Ashley Zhu. Ashley is a postdoctoral fellow at Center for Surgical and Transplant Applied Research at NYU Langone. She is also a nurse with over 14 years of experience in patient and family care, in organ transplant and heart health. She graduated with a PhD from Johns Hopkins University School of Nursing, and her research interest lies in mixed methodology, caregiver science, device therapy, solid organ transplants, cardiovascular disease, community participatory research, and social media in research. She hoped to improve the outcomes and quality of life for patients and caregivers of those impacted by chronic illness. Ashley was a National Institute of Health, a National Institute of Nursing Research interdisciplinary trainee, an American Association of Colleges of Nursing Johnson & Johnson Minority faculty scholar, and a Heart Failure Society of America Nurse Research Fellow. Please welcome Ashley.
Thank you. Thank you for that introduction. I have with me Carolyn as well. She's a project manager for our study. So let me just share my screen.
Sure.
Can everybody see okay?
Yes.
Okay, great. So thank you so much for the opportunity to present here at Community Board 6 meeting. And the purpose of this presentation is to provide some context and background and invite interested community members to join our research study to share thoughts on this new protocol of lungs eligible for organ donation. As researchers leading this study, we want to engage community members in focus groups and share their thoughts on the protocol in order to improve and enhance the protocol before it rolls out in New York City. This new protocol will increase the number of available lungs for transplant and save more lives. So what is lung transplant? It's a surgery to replace a diseased or failing lung with a healthy lung, usually from a deceased donor. A lung transplant may be needed for the following conditions: severe cystic fibrosis, COPD, bronchopulmonary dysplasia, pulmonary hypertension, heart disease, or pulmonary fibrosis. There is an organ donation crisis in the US. Every 15 hours, a New Yorker dies waiting for an organ. And organ donation crisis is especially prominent in vulnerable populations, and they have a much higher rates of chronic illness that may need organ transplants. Blacks, Hispanics, and Asians are populations that have less access to lung transplant. And there is not enough donated organs to meet the needs of these communities. This might be a hard figure to read, but the takeaway is that if you look at the purple bar that represents NYU Langone, and the gold bar, the yellow bar that represents national data, NYU have a diverse patient population for lung transplantation. The numbers, we transplant a lot more Blacks, Latino, Asian population than compared to the national numbers. So we serve the diverse New York communities, and that's why we're reaching out to you guys, because you are the stakeholders that will be impacted by this protocol. Why this study? Like I said in the beginning, the purpose of this study is to increase number of available lungs for transplant. There's not enough lungs to meet the needs of organ transplantations. So over 100,000 patients are waiting for donated organs right now, and more than 6,000 of them pass away while waiting or becoming too sick for surgery. So our proposed strategy is to expand the available lungs for transplant via uncontrolled donation after circulatory death, meaning those who have passed away unexpectedly in the hospital setting are given the opportunity to donate their organs to save more lives. And this strategy has been widely utilized in Europe and Canada. And if our study is successful in the New York City vicinity, we could implement this nationwide and increase donation opportunities in the US by tens of thousands, and also cut the waiting time for organ as well. Which brings us to our protocol that could potentially increase the number of available lungs for transplant. Basically, what we're proposing to do is putting on oxygen using a bag valve mask on the deceased patient to protect the lungs should the family decide to donate while having more time to contact the family. We're not doing anything invasive. We're basically connecting the deceased patient to the oxygen with the equipment that's already on their body. So during this time, the family will be contacted and the patient will be checked for their organ registration status. Keep in mind that most people who comes into the emergency room are not registered donors, which is the left bottom corner in this category. If they're not registered, we will keep the deceased patient on the oxygen until we're able to reach their family. If their family is against it, we will stop the oxygen immediately. If we can't find their family in the next 2.5 hours, we will also stop inflating their lungs. This will give us more time, about 2.5 hours, to contact the family so that they can have time to make decisions regarding donation. So in summary, what we're doing is putting on oxygen on the deceased before obtaining permission from family. And this protocol will initially trial in NYU Tisch Hospital on the very top, Bellevue Hospital, and NYU Brooklyn Hospital. Now, my map is not as fancy as Philip's, but okay. Why are we recruiting community members? We want input from the community members because we hope to establish partnership between clinicians, lawmakers, and the community to ensure program acceptance and sustainability. And community members are the ones being impacted by this protocol. We want to address their concerns. If you can see on the very bottom in yellow, public concerns including transparency and established trust between the clinicians and the community members and the patients. So we hope to receive some feedback from community members to improve the protocol before it rolls out during our focus groups. For example, if the members are extremely against putting on oxygen on deceased family members without permission, then we will take that into consideration and possibly remove this step. Or if they believe that the public will be against it, then we can perhaps establish a public relations campaign to further educate public about what we're doing. So we're planning to conduct 22 focus groups with 4 to 8 participants each over the period of 2 years. And if you can see here, we have all these groups listed. So the diverse communities of New York City, we also have religious organizations. We also have clinicians and doctors, nurses, and social workers, and just a variety of stakeholders. So what will happen in the focus groups is that we will ask similar questions like these. What are your thoughts on the protocol? What's your perception? What do you think of putting on oxygen on recently deceased loved one? What can we do to make this process smoother for the families? So what we're looking for is 4 to 8 community members, and this focus group will be held online and it will be 90 minutes, and each person will receive a $50 Amazon gift card. So if you're interested, or if you have strong opinions or want to learn more about the protocol, please leave your contact information in the Q&A box or email me at this address. And just a little extra slide, you can check your organ donor status on the New York State Donate Life Registry or on your license on the very bottom right corner. And if you're not an organ donor, you can also go to donatelife.ny.gov to register or register at the DMV. So this is our wonderful team of doctors, nurses, lawyers, just a very variety of team members. And so thank you for listening in. And so I'm going to leave my email slide on to answer any questions that you may have.
Brandon, I can't see whose hands are raised.
I don't see any raised hands at the moment from committee members. I do see Aisha's hand is now raised though.
Okay. Aisha?
Hi, thank you for the presentation. I just want to make sure I'm understanding because I don't really know how this stuff works in the first place. But let's say like if someone signed a DNR, none of this would be happening in the first place, correct?
Yes, if they're not registered to donate. If
So-
they're against donation, then we would not be doing anything to them.
So you wouldn't do it for like the 2.5 hours and then call?
Yeah, I
Okay.
wouldn't. Yeah.
Okay. There's one more thing. If so, like what it is just that is this oxygen just to keep the lungs like okay, or like your whole body? Because just
the lungs, yeah.
And
Alright.
just a little bit. It's not enough to actually keep oxygen going through the whole body. It's just for the lungs.
Okay. Cool. Thank you.
Any other hands, Brandon?
I do not see any at the moment.
Okay, no other question from community members? This is very interesting.
Maybe they're saving it for a focus group, you know?
Anybody interested to become a focus group, please let us know. And we can relate to Ashley.
Yeah, for the focus group, we'll just go into more details with the protocol, and we would love to hear your feedback on how can we improve this experience for the patient and then their family, especially their family. How can we make the process smoother? How do we not offend anyone? And like things like that. It doesn't require you to have any scientific background or knowledge, so.
So Ashley, I just want to make it clear. So you are only putting the oxygen if the person has a donation.
No, we're putting on oxygen on the deceased patient before we find out their registration
Okay, so before.
status. Yes. So that'll give us more time to check for their status and also to contact their family.
Yes.
And it's only for those who we don't know their status that will run.
Right.
And if somebody has said, I don't want to donate, then none of this happens. If somebody's concerned against organ donation.
Right. So only for the ones that you don't know the status of organ donation. But for those that says, no, I do not want organ donation, you don't.
Yes, that's correct.
That's good. That's clear.
Because a lot of times, you know, if the family would
I
want to
think-
donate, but then the lung is no longer viable for transplant. So this gives us that 2.5 hours.
Yeah. But do you also, do you have criteria of even the person that would like or that has designated lung organ donation, but the lung has some other?
Yes. Yes, that's why you should join our focus group. We'll go more into detail, but for we have criterias. If there's trauma to the lungs, then they're not eligible. And yeah, there is eligibility criteria.
Okay, good. Any other member?
I see Aisha has her hand raised.
Okay, Aisha?
Sorry, one more question. This makes sense to me. This makes perfect sense to me. But what are the ethical concerns that people have? Is that what it mostly is, ethical? Yeah.
Yes, so technically it's legal to do this. So it's just the ethical part. Maybe some family will feel offended, you know, if you're putting something on their loved one's body, but we're choosing lungs with this study because lungs doesn't require it just requires oxygen, so we can just put a mask on connected to the patient. So we're not doing anything invasive. So that's what the ethical issue is. A lot of times it's an invasive procedure and the family is really against it at that time, you know.
Yeah,
So-
understood. Yeah, that makes sense.
But what about the cultural aspect of that patient? Because there are patients wherein they do not want anything placed in there.
Yes,
That's also included.
Yes, that's why we're having focus groups with a variety of groups, because we know
Okay.
there are some groups that's against donation. We're also talking with them as well. They can be opt out of this.
That's right.
We
Any other-
respect everybody's wishes. We were trying to make everybody happy here.
Yes, yes, of course. So any other question from members? No? Okay, so thank you so much, Ashley and Carolyn. Yes, and thank you so much.
Thank you for having us
Thank you
here.
for the opportunity.
Sure. Okay, so Brandon.
Yeah.
So our next one is the chair's report, isn't it? Brendan?
That is correct.
Okay, so I attended the conversation with the New York City Health Commissioner Ashwin Basan on February 6th, and it was hosted by Council Member Eric Butcher. And I would like to share some issues that we can explore as a project or a topic for discussion in this committee. So the first one is about the mayor's announcement about a directive on an involuntary hospitalization of those with severe mental illness and danger to self. So according to the commissioner, that directive does not represent the mental health plan, and that the Department of Health plan is a more comprehensive plan that includes basic needs, treatment, and housing, and that the city is enforcing reopening of 400 psychiatric beds for those with mental health issues that need inpatient care. The second one is about noise pollution. So according to the commissioner, although noise is a health issue, the regulation of it is under the purview of the Department of Transportation, but the health department will explore more to address the issue. The third one is about pest control. So according to him, the city is always learning new approach to control rats, and one way of controlling rats depends upon the way we dispose our waste. So according to Council Member Eric, If our waste can be sealed in containers, we can control rats. So I was thinking this can be a project for our committee. We can explore the type of sealed containers that can be available in every household in the community. And I'm gonna ask somebody if someone would like to take a lead on this. The fourth one is about the mask mandate. So according to him, we are now in a better situation, no longer in state of emergency. So we have a high vaccine coverage so mask mandate is no longer necessary. So we should now focus on harm reduction, communication, and education. The fifth one is about lifting of the vaccine mandate among city workers. According to him, 99% of the population have received one vaccination, 96% have received 2 shots, and more than 90% are fully vaccinated. Therefore, mandate is no longer needed. The sixth one is about the opioid crisis. According to him, opioid crisis in New York City is a huge public health crisis. And according to the Special Narcotic Team, New York City is flooded with cracks, heroin, and amphetamines, and an influx of fentanyl. So we have to focus with harm reduction and provide access to treatment. So with this topic, can we explore this as a project for us? We can think of how we can educate our community to reduce risk and prevent overdose. And how can we promote and provide more virtual naloxone training for members of our community? And we can also think about ways that we can widely distribute these naloxone. So I would like to hear from members if anybody wants to take a lead on this. Seventh is about the animal control. Animals that could not find homes are being killed. So the Department of Health is in the process of investing new animal shelters and improving the existing one. And the last one is about the COVID testing tents that you see on the street. So the question is that why do we still allow testing tents on the streets? And those testing tents that you see, according to the commissioner, are not regulated by the city, but by the state. So that's all my report. And
Elvie?
yes.
Just wanted to quickly note with one of the things you mentioned, which is the issue of rats and trash containers. I know that was something, or I heard that was something that the Environment and Parks Committee discussed the other night. I see Marty is shaking his head as he's a member of that committee.
Okay, good.
So, I just wanted to note that in case this is something the committee is interested in, that it's something at least previously the Parks Committee has talked about.
Yes.
But it's street trash, not household waste. So I don't know if what LV is referring to is containers that withhold the big trash bags that buildings put out awaiting the garbage trucks to come by. That there's some containers that she's looking at. The Environmental and Parks was looking at the trash containers that people use as they're walking down the street to throw paper or whatever away.
Yeah, I think that's about it. Yes. What about can we do something about the opioid crisis as our project?
Well, you had the presentation on the Narcan.
Right.
That's,
but how can we disseminate more? How can we educate our community to reduce the risk?
I see Hannah has her hand raised.
Hannah?
I just had a question. When we talk about like doing a project, is the focus, are you thinking the focus is education? Are there other types of projects that have worked well in the past? Just trying to wrap my head around like what we could even do.
Yeah, it can be in form of education. It can be in form of developing flyers or developing poster or developing ads just to promote and educate our community. Can be anything.
Okay.
If you
It
have
could
some
even-
other ideas, yes, please.
I'll
could-
think on other ideas for sure. Nothing currently.
Yeah. Or if there are any policy changes that the committee wants that it feels would address any of these issues,
Yes.
resolutions are another tool in the toolbox.
Yes. We can develop, we can develop resolution to address the problem.
Certainly for communication, we can devise some sort of TikTok video, which or something that would be that could go viral rather than handing out paper.
That is a very good idea. Actually, we were talking about that before we started the meeting, isn't it? We were talking about if community board can develop a TikTok. Anybody wants to take a lead?
I see Aisha has her
Aisha.
hand raised.
Yeah, Aisha.
Okay, wait. Okay, for for this, I remember in the presentation, they were talking about the age group that overdoses mostly affect. I don't remember the exact, but it's like older teenagers and then like to like
18 to
20s,
20.
30s. Yeah.
Yes, 18
Yeah.
to
And that's those people like I mean I'm like around that age kind of, and I feel like if there's just a way that we can just like that's so quick and easy that they can get a Narcan kit just super fast, like they're just no one needs to say anything and they just pick it up, and let's say someone's going somewhere party, they have it on them. I think that's really important. And yeah, I like this TikTok idea. It'll
Yeah.
take literally like it's like a 10-second video and we can be like, this is where you access Narcan, this is how you use it, and there's like a little video. Like it's pretty simple.
yeah.
I like that idea.
Let's develop one. I mean, I was thinking about how can we disseminate quickly this naloxone, but the thing is that the Department of Health is not going to distribute or allow you to get it unless you go and attend the training. But if we can develop a TikTok about that one, I think that would be the best.
But I think drugstores are now allowed to issue it without any prior dispensing item. You know, a doctor doesn't have to prescribe it. That pharmacies can just give it out. I'm heard something about that. Whether or not that is the case via the Department of Health, don't know. Something to look into.
Yeah. Are you sure you want to take the lead in this project?
Yeah, but there's like no specific deadline, right?
Yeah, we will, don't worry about it.
Okay. Also, does anyone have the emails of the people who gave us the training on Narcan?
Yeah, Brandon, we have the email, isn't it?
Yeah, I would.
If you could send those to me, I'll just ask them a few questions just to make
Sure.
sure I understand. Yeah. Okay.
Sure.
Yeah. Thank you.
That's good, very good. Okay, I also would like to ask members if you have topics that you would like to be discussed or presented in this committee. We don't have anything else in March.
I emailed to you just before the meeting a couple of pictures that I took in Manchester a couple of days ago, or was it Leeds? Anyway, in Manchester and Leeds, UK, I saw a stationary AED machines, in big squares where somebody might have a heart attack that an emergency vehicle can't necessarily get to them so quickly. They have these freestanding kiosks on the street where if someone's having a heart attack, you go, you push a button and 911 is immediately called, and the defibrillator is in the kiosk.
Wow. And
Oh,
where
yeah,
is- where is that, Marty? Where?
in the UK. I
UK?
saw them in Manchester and I saw them in Leeds. I was there this past week. Actually, I came back on Tuesday. And it was really interesting. I sent you the picture, a couple of pictures of it.
Yeah, I will check. Wow, that is a good one that we can explore.
Yeah, no, a little history about defibrillators in New York. When I was chair of public safety, which was 93 or something like that, 94, I had read about a pilot program in Seattle or Portland where they were putting automatic defibrillators in emergency vehicles, police and fire engines. And I said, and while in New York, the likelihood of death by heart attack in the street was 60%, because the ambulance generally didn't have them, and to get to you and then bring you to a hospital, generally you were dead. In Portland, they lowered it to 4%, or Seattle, wherever it was. So we wrote a resolution to require all emergency vehicles in Community Board 6 to have automatic defibrillators. A state senator, who was it now? I forget his name now. He put $10 million into it. And it spread all over the city. The police were the last organization to accept it because they didn't want to pay for the training. Not that there really is all that much training in the automatic defibrillators because it tells you what to do. But it went into the fire engines and the ambulance and finally the cops, and it spread all over, and it went into gyms now and buildings and
Yeah.
et cetera, et cetera. It's one of the things that I'm most proud of in my being on CB6. I brought the AEDs to New York. Anyway, in seeing this on the street in England the other day, I was saying, wow, that really would do a lot.
Yes, definitely.
And so I don't know who's responsible for producing them. It might be JC Decoux, who does all the street furniture for us as well, because they're all over England as well. The bus shelters and all the other kinds of things on the street. They have the contract here as well.
Yeah.
But certainly we'd be able to figure out who made it.
How do you want us to proceed on this?
Well, we could
Right.
write a letter to the Department of Health of Manchester, UK, and see who provided it for them, and follow up through there.
Yeah. What about also in connection to that topic, like our ambulances do not they do not carry epinephrine.
Oh,
So how do we write a reso on that? How do we
sure,
do that?
absolutely. Absolutely, why not?
So
I didn't know they didn't carry that. I mean,
no,
most people who have allergies, well, those people who know they have allergies carry an EpiPen.
right.
My wife
but-
taught me how to use it. She has an EpiPen, a mock EpiPen that I had to jam into her thigh so as for me to understand how the device is used. But it's surprising that ambulances don't carry that. I mean, that's such a initial response.
Yeah, so they don't. So let's
Yeah, we can, have that resolution on the agenda for next month.
okay.
That should be easy enough to put together, and hopefully we would get a quorum. I don't know what happened to the rest of the committee.
Yeah, I know.
This meeting now is three CB6 meetings at night in a row that I have. I'm saying, I was thinking of trying to convince you to move the monthly meeting to maybe the third Thursday rather than being back to back with the
Back-to-back?
full board meeting.
That's public safety, though.
Oh, that's public safety.
What about the last week, Brendan?
That's Business Affairs and Licensing Committee.
Oh,
That's, I mean,
I know.
if it's something the committee wants to consider in consultation with Kyle, that's fine. But it would be important to make sure that there are no conflicts with other committees.
Yeah,
The back-to-back is about it.
yeah,
May
it's
be
hard.
what has decreased the participation here.
Yeah. So we'll talk about that. And the last one that I would like to ask is about, our the one that we're planning for the summer, the health fair, the June 10. So
I need the list. I need the list of who to
Yeah.
call.
yeah,
It's emailed.
Brendan
Brendan
will-
emailed it.
I'll try
Aisha,
and
yeah,
I'll try and get that tomorrow. I saw the email today, but was rather swamped.
Yeah.
I'll try and get that tomorrow.
yeah.
Um,
And if we can also indicate which one that you guys have already called, so there's no duplication of call. Yeah, Aisha, you have a question?
Yeah, it's about the health fair and how we were talking about CPR. I'm CPR trained and AED certified, but I did it with lifeguarding, which was like 3 days. So I don't know how long it takes to get CPR and AED certified, but if it's not that long, we should first definitely do that at the health fair. See if we can get someone to train. I think you have to go somewhere, but maybe we could do it on in a with their stand or something. And then
Aisha, I'm a CPR AED instructor.
really?
Yes.
Help me do it.
I'm the one that conducts the CPR training in the Department of Health. But we do have mannequins that we use for the CPR, and our mannequins are high tech because it tells you whether you're compressing correctly or not. Because there are mannequins that they don't tell you, but our mannequins, it tells you because it blinks. There's a light that blinks if you're not compressing that deep.
Wow.
Yeah,
Mine did not do that.
but-
Mine kind of made a sound, kind of clicked.
Well, if we can do that, yeah, but I would not be able to do that day because I'm gonna be running around. But if somebody,
Ask a friend.
yeah, if somebody can do that, yeah, that is a good idea.
Does the mannequin also play Staying Alive so as to get the right rhythm?
That is, yeah, I mean, that is the right rhythm.
Okay, so if you have any topic that we can topic that can be an agenda for next month, please just feel free to email me and Brandon, please. And if there's any other old or new business, and if there's no other old or new business, if there's no objection, we will adjourn the meeting. Any other question? Okay, seeing no further business, the meeting is adjourned at 7:50. And thank you so much, everyone, for